But why you are calling it as a autistic spectrum disorder means due to some autistic issues, there are some other umbrella issues like spectrum disorders. So in autism, one is there are some symptoms of autism. One is speech delay. Second is speech delay, also known as the problem of communication. Second is the
irregular psychomotor activities.
Second is the social issues. Third is the behavioral issues. This is the broad explanation of autistic behavior. Number one is problem of communication. Second is first one is lack of communication. Third is problem of social interactions. Third is behavioral issues. The problem of communication issues leads to some social issues, poor social interactions of this lack of communication. Third is due to lack of communication, the lack of communication leads to poor social interactions. This lack of communication and lack of proper social interaction leads to some sort of behavioral issues. These three are the broad issues of the autistic behavior, autistic cases. Okay, there are 5 or 6 symptoms of autism. One is speech delay, or you can say problem of communication. Second is
behavior,
poor social interactions. Third is not responding to a name call. Fourth is poor social interactions. And these are all symptoms leads to behavioral issues. Okay, so in childhood behavioral disorders, first one is the autism, or you can say ASD, autistic spectrum disorder. The term autistic derived from the word auto. Auto means self. Autos means self. Always they will have their own activities, self-play, self-talk, self-cry, self-love. Autos. The word autism derived from the word, it is a Latin word, autos, means self. These self-related issues are more, symptoms are more in that autistic cases, in those autistic cases. That is the reason self-play, self-pride, self-love, self-talk. Again, there are different type of plays. One is solitary play or self-play. Number 2 is parallel play. Number 3 is cooperative play. Number 4 is the play related to some rules and regulations. So in this case of autism, mostly these autistic children are busy with their own play activities. They always involve in their own play activities. They won't mingle with other children in the group. That is called solitary play or self-play. This is one issue related to the behavioral. Number 1 is autism, or you can say autistic spectrum disorders. In this autistic spectrum disorders, some cases, recent cases, including the childhood schizophrenia also. This is some limited case, some specific cases, very limited cases of autistic, or you can say childhood schizophrenia cases. Number 2, ADHD. ADHD, attention deficiency hyperactive disorders. Attention deficiency hyperactive disorder. So the term itself, ADHD, attention deficiency hyperactive disorder. In this ADHD, lack of attention, lack of concentration, then hyperactivity. So that is the reason this is one important behavioral problem in the children. Autistic spectrum disorder is number one, ASD. Second is the ADHD, attention deficiency hyperactive disorder. In this attention deficiency hyperactive disorder, again there are some symptoms. One is restlessness. Number two is poor sitting tolerance. Number three is not waiting for his turn or her turn. They won't wait for his turn. For example, they are in the queue, they won't wait for long time. That is also one important symptom of autism. Then tantrums, temper tantrums, means throwing things, destroying the things, and destroying type of behavior. Throwing the things and getting the things from others. On disturbances, others' activity. Destroying behavior, distress behavior, aggressive behavior. These are all symptoms of ADHD. Their sitting tolerance is low, poor concentration, poor social interactions, restlessness, destroying things, not waiting for his role, not waiting for her turn, and aggressive behavior, tantrums, temper tantrums, throwing things. These are all some symptoms of ADHD. Number two. Here, the difference of artistic behavior and the ADHD cases means in autism also one symptom, that is restlessness. Okay, Deenaji. Yeah, in ADHD also hyperactivity. This hyperactivity symptom is common in both autistic cases as well as the ADHD cases. But in some psychologists or some counselors or some therapists, behavioral therapists, they'll confuse by seeing the autistic cases. They'll have their primary impression or primary diagnosis as ADHD. To avoid these confusion, whether it is ASD case or whether it is ADHD case, there is a clear cut. That is, there are some testing tools. For example, for ASD, there are some tools. Means tests, psychological tests. One is ISA, Indian Scale for Assessment of Autism. Indian Scale for Assessment of Autism. That is one tool to confirm the child is having some autistic behavior or not. Another tool, another test of diagnosing the autism is CARS, CARS, Child Autism Rating Scale, CARS. The first test of autism, if you want to confirm whether it is whether this case is autistic case or not. One is ISA, Indian Scale for Assessment of Autism, ISA, ISAA, Autism Scale. Number one. Number two is CARS, CARS, Child Autism Rating Scale, CARS. If
Child Autism Rating Scale, right?
If the child is below the age of 16, below the age of 13 months and above the age of 16 months.
Rating scale.
So these first ISA test and another CARS, these both are above 2 years of age child. If the child is below the 2 years,
Yes.
the child is below 30 months of age, you have some other test tool. That test name is this charts.
Can you
M
please
chart.
repeat the age limit, sir?
ASD. You want me to put the ASD full form or tools?
Limited.
Tools, sir.
Tools.
Tools.
First one is ESA. For ASD case, first test of confirming or diagnosing the autism, that is ESA, ISAA, Indian Scale for Assessment of Autism. ISAA, Indian Scale for Assessment of Autism.
Age criteria for this test, sir?
Yeah, age criteria is about 2 years.
About 2 years.
Yes. Another test is CARS, CARS. Child Autism Rating Scale. Child Autism Rating Scale, CARS. Okay, that is the second test of diagnosing the ASD or autism. Third one is if the child is below the age of 30 months and above is 16 months. Okay, that is M chart. M chart. MCHAT. M chart. Okay, so here in this test, whether the child is having autism or not, that is number one. If the child is autistic child, whether the symptoms are severe, moderate, or mild symptoms, that also you can check based on these test items, based on your administration of your test. After administering this test, we'll find whether the child is having autistic behavior or autistic symptoms or not. If the child is a case of autism, this child is having mild autistic symptoms, moderate autistic symptoms, or severe autistic symptoms. Even the mild also 50% symptoms, 60% symptoms. Even the moderate also 70, 89. Those percentages also you can find out after completion of this. So this is related to the autism. Okay. Same way we have test of, we have ADHD also. In ADHD also there is one test to find out there is ADHD symptoms in the child or not. In ADHD, there are 4 domains of, as I mentioned, in autistic, there are some symptoms like communication, problem of communication, problem of social interactions, problem of behavior. These are the 3 important domains of this ASD or autistic case. Same way, in ADHD also, there are 4 main domains you need to check. First one is impulsivity. Impulsivity. Any doubt, Dinaj?
Yeah, I'm writing, sir.
Again,
Impulse,
repeat.
attention deficit, no, sir.
Attention
Not able to.
deficiency hyperactivity disorder. The full form of ADHD is attention deficiency and hyperactive disorder or hyperactivity disorder. AD means attention deficiency, HD means hyperactivity disorder. Okay, for these ADHD, there are 3 important domains we have to check. One is impulsivity, second is inattention, third is hyperactivity. I repeat, impulsivity, then inattention, third is hyperactivity. These are the 3 domains. You will check in the scale, in the tool. Okay. After completion of your administering the test of ADHD, you will find that it is severe, moderate, or mild. Same. Okay. So number 3 is childhood anxiety disorder.
Sir, what are the tools we use for ADHD, sir? Tool names.
For ADHD,
Yes, sir.
direct ADHD tool is available.
Only one. Okay, sir.
ADHD tool is
Like for autism, we have 3 different.
Yeah,
Like that.
same way ADHD tool is available. Our Indian version is also available. Direct tool, it is ADHD. Okay, it's a tool of ADHD. That's it. There are some items of the ADHD. You need to in this item, total item, there are 3 domains in the total items. One is the domain of impulsivity, and other is inattention. Third is hyperactivity. Yeah.
Sir, can we categorize in this test, sir? Mild, moderate, severe?
Yes,
Profound.
based on the
Yes.
based on the tool,
Yes.
based on the scoring. See, Deepaji, any tool, any test, you need to follow the manual. Any tool,
Yes, sir.
any
Yes,
test.
sir.
In that manual, clearly they'll give. For example, if you take ESA test, okay,
Yes, sir.
if the total points are below 70, total score after the administering the test of ESA, if the total score is below 70, okay, so no autism.
Okay, sir.
If it is between 70 to 106, mild autism. Again,
Yes, sir.
there are some divisions of mild autism, 50% mild or 60% mild, subdivisions.
Okay, sir.
Okay,
Yes, sir.
for your examination point of view, just only I'm talking about all those things, but if at examination point of view, it is autism, symptoms of autism, ADHD, what is ADHD, what are the symptoms of ADHD, what are the other domains of ADHD. These are the main things you need to study.
Okay, sir.
Okay.
Thank you,
After
sir.
completion of your post graduation, if you want to join as a psychologist or as any this thing, you can.
Okay, sir.
Okay. Anyway, you need to know this. You better to know these tools. The name of
Age criteria for the ADHD test, sir.
ADHD.
Test age criteria.
Any child. ADHD test about 2 years. Okay. Any doubt?
Sir, if
Yeah. Next
if
one
it
is
not
childhood anxiety disorder. Childhood anxiety. First one is autism. Second is the ADHD. Third is the
ADHD.
main the another important category of behavioral issues among the children is childhood anxiety disorder. Childhood anxiety disorder. In this childhood anxiety disorder, number one is phobia. Phobias. What are the phobias? You know the some of phobias like hydrophobia. Then
Agoraphobia.
yeah,
Agro.
agoraphobia. Then
Claustrophobia.
claustrophobia.
which phobia?
Claustrophobia.
Okay.
Pedophobia.
Agoraphobia. Hydrophobia means
Water aqua.
water.
Water.
Hydrophobia means HYTO.
Heights.
Yes, heights. Agora means group of people. There are different type of phobias. Okay. So here, this child anxiety disorder, first one is the phobia. Second is GAD, generalized anxiety disorder. GAD, specific anxiety disorders and generalized anxiety disorder. Means no specific phobia, but their anxiety is related to all items. No specific, no particular item. Anything that is known as the generalized anxiety disorder. Generalized anxiety disorder. First one is specific anxiety disorder. That means phobic cases.
Phobias.
Second is
Generalized anxiety.
GAD, generalized anxiety disorder. Third one is panic disorder. Panic, PINIC, panic disorder. Panic means fear of anything. Okay. Another one is OCD. What is OCD?
Obsessive compulsive
Obsessive compulsive
Yes,
disorder.
yes. Good. Obsessive compulsory disorder.
Sir, can I ask,
Yeah, yes,
this
yes.
panic disorder, should we relate it after the any panic incident happens, disorder comes, or the child is already having that panic disorder? For
You're talking
example,
about after having some experience of that is
at
PTSD.
earthquake or
That is called
storms
as
or
a PTSD.
okay.
That
Okay.
is PTSD,
Post-traumatic
post-traumatic
Stress disorder.
post-traumatic stress disorder,
Okay.
PTSD.
So this panic disorder
This
is
panic disorder,
different.
which causes terrifying panic attacks. Of course, there is some difference between these both. Okay, so here, which causes terrifying panic that include physical symptoms such as a rapid heartbeat and dizziness.
Okay.
Panic attacks related to the physiological. Okay, whereas PTSD means anything like earthquakes.
What might be the reason for these panic disorders, sir?
Means sudden thing happening in our family or even their own self.
Okay.
Okay, PTSD means after traumatic disorder, any traumatic issues, that is the PTSD. Okay, so here as I mentioned, artistic maybe, hyperactivity maybe, then unrealistic fear maybe, shyness, other important symptoms of childhood unsocialized symptoms like over anxious, or you can say withdrawn symptoms, withdrawal reactions among children. Withdrawal reactions among children means unrealistic fear, number one. Number two, shyness. Number three, stuttering, stammering, which related to speech issues. Okay, and sleep disturbances, fear of school. Okay, these are all some other issues related to the children. Now, our counseling part, how to.
Sir, one question I have.
Yes, yes, yes.
So where does this emotional disorder come? Like, the
Emotional
child
disorder.
is like overly like all the time crying for anything. Like where does this kind of disorder come? Is this a disorder like emotion, always being emotional for certain things?
Age.
So where does this category fall, sir?
Age?
Emotional disorder.
No, you are talking
Any
about
age,
the
any
specific
age.
case, or you are asking about any
Age, small babies only, childhood.
child age you are talking about?
No, sir, like I'm talking about this emotional disorder. Which category does this fall?
So these are all related to emotional only. No, for example, anxiety, fear, disgust,
Okay.
anger.
Oh, these all are like
Related to
emotions only.
Our perspective is, see, if you discuss these issues in the perspective of, in the angle of emotions, there are some emotional issues of these disorders. But
Yes.
our topic now is we are discussing these issues in the perspective of behaviors.
Behaviors. Okay. Right. Okay.
I repeat, see the psychology, the behavioral science. There are three important domains of our behavior. Number one is cognitive. Number two is
Affective.
affective. Third is
Psychomotor.
Emotional, sir.
emotion comes under this one, no? This affective only.
Psychomotor. Cognitive,
Effective.
affective.
Okay, sir.
Cognitive or activity based, or you can say behavior. First one is cognitive, means intellectual. Second is affective, emotions. Third is our activities, or you can say behavior.
Right. Got it, sir.
Got it?
Yes, got it, sir. Thank you.
Yeah?
Yes, sir. Yes.
Yeah.
Sir, I have a small doubt, sir.
Yes.
Sir, do we need to mention also these tools, sir, while writing an examination?
If you mention it, it's good.
Okay.
Actually, our expectation of as an examiner, while you are,
Yes,
it means evaluating your papers.
Yes, sir.
Evaluating your papers. So, whether you know about the symptoms of how you define the autism.
Yes, sir. Symptoms and everything we'll explain. These tools will give effective effect.
For your knowledge only, I am explaining all this.
Yes, sir. Yes, sir.
If you want
Thank
to
you very
mention,
much.
you can mention. These tools are available online also.
Okay, sir.
Yeah. So, yeah, as a counseling psychologist, as a counselor, as a professional, as a therapist, behavioral therapist, how the see our topic, our course is the counseling psychology course. Our seventh paper is the counseling psychology. That is the paper name, no? Counseling psychology. Got it? Paper name, the course name is seventh course name is the counseling psychology. So in the counseling psychology, we need to discuss any topic, any issue. What are the main symptoms of that issue? For example, if I say autism, what are the main symptoms of autism? How you say this is autistic child? He is an autistic child. So based on these symptoms, no? Okay. So we need to mention in an examination point of view what is autism. What are the symptoms of autism?
Okay, sir.
Thirdly, what are the reasons of autism?
Yes, sir.
Any issue. Okay, in order to know the symptoms after completion of your confirmation of your autism or any child's autism, what to do next? What are the reasons of this autism?
Diagnostic tools.
Okay, the reasons.
Yes.
Same thing, no? See, for example, if a child or any individual approaches the doctor, he will see for pushing up. So what is happening? So, sir, I am having some fever. What the doctor's test generally he will ask, or she, the doctor will ask. So what are the reasons? Whether you went to other place, what is the reasons of his cold? What is the reasons of his fever? Those things we'll check, no? In any doctor.
Yes, sir. Yes, sir.
Same way, in the psychologist, in the counselor, even the therapist also, when the child's parents or the caregivers of the child, okay, bring the child to you or any psychologist, he will observe the child. By his observation or by her observation, if he or she finds if he or she found any symptoms of autism, what to do? He or she will ask what are the reasons, or he will find some reasons of this autistic child.
Yes, sir.
As I mentioned, if you approach the doctor with fever, definitely the doctor observe what is the reasons of this particular issue. The same case here also. Now
Okay,
the
sir.
reasons of these childhood behavioral issues. Number one, prenatal. Number two, natal issues or perinatal. Number three, postnatal issues. Got it? I repeat. First one is we need to check any issues related to the prenatal. What is prenatal? Prenatal means
During pregnancy, sir.
prenatal. I am talking about prenatal, not perinatal.
Okay.
Before conception.
Yeah, before.
Conception, conceiving.
No. During
Any disorders
during the
in
pregnancy
the
time, that is the prenatal. 280 days time. After formation of the zygote till the delivery time. That period is known as the prenatal period. 9 months, 10 days time, or 280 days time. Okay. So these reasons we need to check. Number one, prenatal. Then natal, or you can say perinatal. Prenatal and perinatal, or you can say natal. Perinatal means or natal means during delivery time. Third one is postnatal, after delivery time, at least some weeks after delivery. These are the various issues we have to check as a professional. Is it okay? These are the three important factors we have to check.
Okay. So there are two other concepts, runaway reaction and counseling the delinquents.
Okay. Runaway. Those we have lost. First of all, we will check the these factors. Runaway means runaway also one type of deviant behavior. Deviant behavior. Okay. Run away from the home, run away from the schools, run away from the institutions. Okay. Okay. So getting out a distinct family situations. Why this? We are discussing about the factors. Okay. If there is a runaway, what is the reason of this runaway? How the family environment? Maybe in some cases, runaway for some reasons of not mingling with the siblings. Maybe some environment is not suited to the child. Inability to seek assistance. Okay. Treatment of the parents. Okay.
Sir, this is, since it's a counseling psychology, I'm a bit curious. If I go to a school as a counselor and there is a tendency of this runaway
Loudly, please tell.
reaction in the students, if when I talk, are we able to sense that one? What would be the symptoms that this child is facing this kind of?
Please ask loudly. Your voice is very low.
Okay.
Try to increase
This being a counseling psychology, if a counselor is encountering a student who has this tendency of runaway reaction, so are we able to sense that reactions from the child? Like, can we guess that this child is going to do this one? Any symptoms like that for ADHD and ASD, all that we know, we have a tool and we have some checklist to follow, but this is really vague. But how can we identify that this child, is there any guessing or?
Yeah, good. Nice.
Miss
Good.
Deena,
Yeah.
it's a good
Here,
question, Miss Deena.
Here, so Deena, you are Deena, no?
Yes.
Yeah. So here, your question is that how to identify this child is having some symptoms of autism, or how to identify this child is ADHD case. After the observation only, you will go for the assessments, no? So your question is that how to primarily identify in this case. Is it that question? No? That is your question, is that?
Yeah.
No,
With regard
Actually,
to runaway reaction.
Yes, Deena. I understood your question. What Deena is trying to understand is, if a child is having a runaway reaction, so how to identify this and how to counsel this? So,
So
this
first of all, Deena,
reaction,
just I'll tell you. So here, first of all, if it is an autistic case, there are some symptoms of autism. Number one, poor eye contact. Their eye contact is very poor. They won't contact directly. Number one. Number two, delay in response. Delay to the name calling.
I'm sorry, sir, to confuse you. I have understood the autistic disorder and how to identify all that. But my
Sir, ma'am is asking about runaway symptoms, sir.
Reactions.
It is difficult to identify, madam, because it all causes because of the reasons and reasons behind it. So we need to focus on the reasons. If a child is disturbed a lot, is facing a lot of problems or something, then you need to counsel him from it. There are various aspects to identify. That is a process of that. Is there any tools, sir, to identify this reaction? Basically, she wants to ask this question.
no, there are no
specific
tools.
runaway
There are
reaction.
no,
Only
there are
runaway
no tools.
reaction.
Please, I request first the lesson to be continued. Please, I request is let the lesson be continued. You can take a question session like at the end of the class. It's my suggestion only. See, let the class continue.
Okay. Even runaway also, see, not only this runaway case, autistic, ADHD, even runaway or any deviant behavior of any child. So you need to interact with the parents as well as the teachers. No, we have tools. Some tools are related to the parents rating. Some tools are related to teacher rating states. Okay, based on the items given in the tool, the teacher has to respond based on the items of responding from the teachers or from the parents. So you can identify these cases, some behavioral cases or some deviant behavior among the children. Got it? Yeah. So here in the factors of reasons of these behavioralists, number one is prenatal, second is the perinatal, or you can say natal case. Third is the postnatal cases. And these are all related to the natal issue. Another one is heredity and the environment. Heredity and environment, any heredity, any genetical reasons. Those things also we need to check from the parents. Okay, any genetic reasons related to genetical issues like their family background. Okay, these are all the issues we need to discuss. We need to check from the parents. And yeah, in perinatal, especially prenatal means, you know, that perinatal means whether any health issues of mother or any habits related to the parents and any stressful condition during the pregnancy or any anxiety related to the parents during the pregnancy. These are all the related to the, these are the issues related to the prenatal. Then post, that is natal cases, you know that there are 5 or 6 important aspects we need to check. Number one is type of delivery. Number 2 is whether it is lower birth weight or normal birth weight. Number 3 is whether it is delayed cry or normal cry. Okay, or you can say immediate birth cry. IBC means immediate birth cry. DBC means delayed birth cry. Okay, and third one is birth weight. Okay, these are all some issues related to the perinatal, or you can say during the delivery time. Third one is postnatal, like any jaundice, any seizures, or any problem of feeding, whether it is normal feeding or bottle feeding. There are all the various reasons we need to check. Okay, then counseling. Any issue, as I mentioned, first of all, we need to describe the autism, describe the ADHD, describe the general anxiety, GAD, describe the, or you can say, you need to define the phobic cases, then reasons. Third is the treatment part, or you can say counseling part. In counseling part, first of all, we need to counsel the parents. Okay, some parents are reluctant. They won't agree. They won't accept. They will bring the child to the psychologist, but they will tell, sir, this is the problem. Just only recently only. So here they won't agree. If you say, if you explain, if you tell them your child is autistic child, but it is not so easy to accept that issue. They won't accept. Okay. So here acceptance in your first session of counseling. In first session itself, you have to develop the rapport. Rapport establishment is the first and foremost stage of the counseling, especially in the psychological counseling. So you need to counsel the parents first. You need to explain these are the steps. These are the symptoms of autism. So as I mentioned, as Dinaji mentioned, after observation, because in psychological subject, there are some methods of psychology. One is observation method. Introspection also one method, but observation is it's a common method generally used whenever you want to see, whenever you want to confirm the symptoms of any psychological issue. You have to observe. By your observation, by our observation, if you find some behavioral issues like artistic issues, problem of speech, problem of social interaction, problem of maintaining good eye contact. These are all the some issues. If you observe, so better to go for the assessment. For after assessment, you better to, and we need to explain all these scoring. What are the scores available? What are the scores? So we need to explain to the parents so that they will accept. Acceptance is not that much of easy task. It's the toughest task. Even you also, if you are there in the situation, we won't accept. We won't agree. Our child is a problematic child. The psychologist, after administering the test, if he or she disclose those results, is scores. The parents have some sort of stressful conditions. Okay, you need to address those parental issues also. Okay, so that slowly they will accept. You know, there are 7 stages of acceptance. One is anger, shame. There are some 7 stages of acceptance. You have to counsel the
So could you repeat
parents.
7 stages of? So because of the disturbance we couldn't hear. Can you repeat, sir?
Sir, Vamsi Krishna garu tarvata K అని ఉంది ఎవరిదో ప్లీజ్ మ్యూట్ సార్.
Okay, so here counseling the parents first, so that they will accept the case. Okay, so after acceptance, what to do? Here, if there is any behavioral problems, we have some behavior modification programs, or you can say behavior modification techniques. What are those behavior modification techniques? These behavior modification techniques are
Conditioning, sir, classical conditioning, operant conditioning.
in the behavior modification program. We need to know the various conditioning theories. We need to understand the conditioning theories like classical conditioning theory, then operant conditioning theory, and social learning theories.
Observational learning, sir.
These are the 3 important theoretical models, theoretical principles, theoretical foundations you have to keep in mind while you are giving this type of behavior modification program or behavior modification technique. In the counseling of these children related to the behavioral issues, first of all, behavior modification program or behavior modification technique. One, you need to list out those behaviors. First of all, for example, in the autistic case, ADHD case, or any other phobic case or OCD cases, what are those symptoms, what are those issues, you have to list out and prioritizing one by one case. For example, self-injurious behavior. Some cases, self-injurious behavior. Self-injurious behavior, restlessness, and poor social interactions. In these three issues they mentioned, if these three issues, if you find in that particular case, the client, you have to give topmost priority to the self-injurious behavior. Okay, so this is the way of list out the behavioral issues, and if there is any issue related to the phobia or OCD. Phobia means that is one type of fear, anxiety related fear, anxiety. You need to reduce that anxiety through some therapeutical procedures or through some therapeutical techniques. One technique of therapy or one technique of counseling in case of phobia or OCD is systematic desensitization. Systematic desensitization. Sensitization, desensitization, then systematic desensitization. Sensitization means fear or anxiety is the sensitization issue. You need to desensitize those fear or fearful aspects. Systematically means stepwise. Systematically, desensitization is one technique to address the case of phobic or phobia. Third is, if it is generalized disorder or OCD cases. In OCD case also, some techniques or therapeutical procedures we have to use. In case of OCD, ERP is one technique that we use for OCD cases. ERP means exposure response prevention. Exposure response prevention is one technique. Expose the client in the same situation, so the response will be slowly preventable. When we expose the client to the same situation of obsession thoughts or obsessive thoughts, what are the response in that situation we need to prevent? So that is one technique of ERP for OCD cases. So these are the various techniques of therapeutical procedures we have to use based on the issue. I repeat, first of all, we need to explain the issue. For example, ASD, ADHD, social deviations, or you can say runaway, OCD, then panic disorders, phobic disorders, GAD, these are the issues. Then secondly, symptoms of these issues. For example, if you say OCD, what is the OCD? Obsessive thoughts leads to compulsory disorders. OCD. O means obsessions. C means compulsions. D means disorder. OCD. Depending on their obsessive thoughts, there are some compulsion disorders, compulsory disorders, compulsory activities. These activities are continually, constantly, if they do, so that is a disorder. Disordered behavior. Ordered behavior, disordered behavior. Normal behavior, abnormal behavior. So these obsessive thoughts leads to some compulsory activities. For example, some clients or some patients, some individuals, they'll always think about the dust particles. If they touch the surface of any object, they'll feel some some dirt particles are deposited on their face or on their hands. That is the reason they'll go and they'll wash their hands repeatedly. This repeatedly washing hands is the compulsory activity. After washing their hands only, their anxiety will be reduced. When they touch the surface of any object, anything, their anxiety will be very high. In order to reduce their anxiety, in order to manage their anxiety, they'll go and they will wash their hands. What is the O here? Obsessive thoughts means the thought process. They think that dirty particles are deposited on their hands or on their face. That is the obsessive thoughts. These obsessions leads to C. That is C means compulsory activities. Compulsory activity means repeated hand wash. So you can't reduce the repeated activities without reduce the obsessive thoughts. In order to reduce the compulsory activities, first of all, we have to reduce the obsessive thoughts, or I can say obsessions. Okay, for this, there is a technique of ERP, exposed response prevention technique. These are all various techniques depending on the issue of any area. Any doubt?
Sir, is there any technique for GAD, sir?
GAD, general anxiety disorder. Same, general anxiety disorder, specific anxiety disorder. Specific anxiety disorder is phobic cases. General anxiety disorders means generalized anxiety. We need to find out why. For example, generalized anxiety, that anxiety is generalized for any issue, any case. They can't explain why their anxiety, they can't explain what is the reason of their anxiety. So you have to check any environmental issues, any environmental factors, any factors related to their thought process, any issues related to the cognitive levels, why their analysis like that. That is the reason why they're analyzing these things to lead or these issues leading to the anxiety, that is increasing their anxiety. There is a difference between the general anxiety disorder or specific anxiety. General anxiety disorder means in general, in all days, all cases, in all situations, any environment, their anxiety will be high. Okay. So,
okay,
for example, you are asking about the techniques. ABC is one model. ABC means activated event. B is belief system. C is consequences. This is another model, or you can say another technique of addressing these anxiety disorders. ABC means A is activated event. B is belief system. C is consequences. This ABC also in a different ways you can. A means activity. B means behavior. C is consequences. In any way, you can use this ABC model. For example, if you say it is activated event, due to their anxiety, because of their anxiety, based on their anxiety, some children or some individuals, they won't enter into some places. For example, closed places. Okay. So you have to, that is the A. A means activated event, or you can say activity. What is activity? Or what is activated event? They won't enter into the crowded places, or they won't enter into the closed places. In both cases, that is the activated event. Their belief system is that if we go to that closed places, or if you enter into the crowded places, I may not be in a position to speak out. Okay, that is their belief system. Based on their belief system, they won't mingle with other children. They won't mingle with other people in the group. So based on their belief system, B, their activities. A is depending on the B, not B is depending on the A. Try to understand. The wrong belief system, negative belief system leads to these activities. That is A. A is depending on the B. Then next one is C. C means consequences. What happens in some cases of students? They will explain the topic. They will discuss the topic one-to-one. If the teacher asks the topic, if the teacher or the lecturer explains the student, asks the student to explain the topic, in a limited group members, they will explain, they will discuss. But the same student, when the teacher or when the lecturer asks the student, a large group of children, what happens? Hello?
Yes, sir.
What happened?
Yes, sir. Audible now. Now audible, sir.
Any
You
technical
got
issue from the other end? I think it's from my side. No,
you got logged out and reconnected, sir.
Okay, sir. From my side, sir.
okay. 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 These are all the various techniques we have to use in these issues related to the behavioral issues. So next topic, when we go, shall we move to the next one, or any clarification if you want? Because another we have only some 7 classes and another some 11 topics, 11 units we have to cover within this 7 classes. Yes. Any doubt?
No, sir.
Okay. Next unit is educational, vocational, and career counseling. Educational, vocational, and career counseling. First of all, what is counseling? That we need to understand first. Already we discussed in the previous initial classes, but still in this 15th unit also, what is counseling first? Then guidance. Then difference between the guidance and counseling. This is one question generally you have to answer in the examination point of view. What is counseling? Anyone?
Guiding and helping a
Guiding and helping. Any other views, another opinion?
helping the client
overcome from
to
the problem.
client to decide what he has to do, like giving him opportunity to analyze what his thoughts and what is best for him, and making him aware of his own needs. And I think that's it, sir.
Okay. Anything else? Okay. Counseling is basically in your both responses. Help is the main component of the counseling. Help. It's a help. Counseling is basically help. Okay. To whom? The person who is in vulnerable condition. The person is not in a position to identifying his own abilities. Okay. So counseling is help the client, help the person, help the client, that is individual, to help himself. Counseling is helping, number one. Number two is counseling is help the client, help the individual to help himself or herself. Okay. For example, if they are not in a position, if she or he is not in a position to identify their own capabilities in order to make them empowered, in order to make them to identify their own abilities, counseling is needed. Okay, so that is the reason counseling is help the client to help themselves, to identify them in a better manner. Okay, but what about the guidance? What is guidance? Guidance is guide the person in one situation only. Your guidance and our guidance is needed in order to solve that problem, solve that issue. Our guidance is needed. After resolving that issue, he won't or she won't come to you. Again, if there any other issue is raised, other problem is raised, again they'll come to you, or they'll come to any therapist. For every time, this help is needed in the guidance process. Whereas in the counseling, once the client came to the psychologist or came to the counselor, in counseling process, that person who is helping is known as a counselor. The person who is getting the help from the counselor is known as the counselee. Counselor and counselee. So when the counselee, when the patient, when the client approach the counselor or the psychologist or the therapist, in order to resolve that issue, in order to solve that problem, he will empower, because we will ask the client to identify their abilities. With those abilities, with those competencies, with those competencies of the capacities of the client, we act as a facilitator to solve that issue from their own, not from our just we act as a facilitator. We will give the facilitating the person, client, so that he will identify his abilities. He or she will resolve that issue with the help of the counselor. So this problem or this issue will be resolved. But whenever the next any other issue in the future course of time arises, this client won't approach the counselor. Why? Because he know how to resolve that issues with the help of his own capabilities, with the help of their own competencies. That is the reason he won't come to you, he won't approach the counselor in any other incidents. That is counseling. In order to resolve that issue, we empower the client. Okay, that is count. But whereas guidance, every time the person, the individual, whenever the problem arises, whenever the situation arises, definitely they will come to the guide and he or she will take the guidance of the guide. That is the difference between the guidance and the counseling. Number one. Number two, counseling is the part of guidance, whereas guidance is not the part of counseling. Second difference. Number three, counseling is the specific aspect, whereas the guidance is the generalized aspect. We will give the general help in this guidance process, whereas in the counseling specifically we will explain the various issues. Fourth one is that counseling is deeper. It's a deeper aspect, whereas guidance is the broader aspect. These are some differences between the guidance and counseling. Any doubt?
Sir, counseling is part of guidance, but guidance is, can you please repeat that?
Counseling is part of the guidance.
Okay.
But guidance is not the part of the counseling.
Okay.
Is it okay?
Yes, sir.
So in order to give the guidance, if there is any specific thing is arranged, so in that specific aspect only, for the particular specific aspect only, we'll give the counseling. Guidance is a broader aspect. Got it? Yeah, in this educational, vocational, and career counseling. So in educational aspect, what are the main areas of the educational counseling? Educational counseling means the areas of education counseling is broadly divided into three sub areas. Number one is it deals with the appraisal and the strengths and weakness of the person. In educational counseling, we have to identify the strengths and weaknesses. Means some individuals will have some sort of strengths. Those strengths are the individual to identify. And some clients, they have some sort of weaknesses in their education aspects. For example, after completion of their schooling, the students will approach their teachers or head of the institutions to give some sort of advice, help in choosing the subjects of their 11th and 12th classes. If it is a CBSE and ICSE system. If it is any state board examinations, so they'll ask that his counselors or his therapists or the psychologists, so which subjects they have to choose after entering into the +1, +2 or board of intermediate course. In that process, we have to identify their strengths and weaknesses. That is number one. Number two, how their study skills. Study skills means how much time they will be in a position to spend per hour or per week or per month. So these things also we have to check while giving the counseling to the students. Number 3 is the problems related to the persons when they are improving their skills. Study skills, you can say. Okay. How their various issues related to the education issues like memory, concentration, subject related issues. For example, some students they feel hard in some subjects like mathematics and physical science or physics. Okay, these are all the various aspects we need to check when we are giving the counseling to these at least children. Okay, and the counseling is concerned primarily with the personal development of the people. Not only these educational academic aspects related to the curricular activities, some other activities related to the co-curricular, extracurricular activities also we have to focus on to improve their personality development. Then I ask them to identify the individualized issues. Individualized issues means, IDs, individual differences. In some students, they will compare their abilities to other students or other classmates. Ask them to identify their individualized issues, individualized abilities. Okay. Then the approach and techniques to be adapted depend on the individualized behaviors. Then counseling is oriented towards cooperation between the people and the counselor. So here some sort of relational issues like interpersonal issues. If you find any problem of interpersonal issues, those things also we have to check, we have to focus on when we are giving the counseling to the student related issues. Then in any special knowledge, or you can say specialized competencies are there. If you find any competencies are there in among the child, so those things also we have to identify and ask them to identify those issues. Then how to maintain the group dynamics also we have to improve among the children in order to give the counseling to this educational aspect. Here also some sort of tools are available like DBDA, David's Battery of Differential Ability, DBDA. Okay. So what is DBDA? DBDA means David's Battery of Differential Abilities. So their abilities we have to check. Okay. For example, after completion of their graduation or completion of their +2 or of completion of their schooling. Okay. Okay. So here, in this case, we have to check whether these children or these students or these individuals are having interest on the particular aspect or not. Abilities to be checked, abilities to be identified, abilities to be assessed based on their abilities of the students, based on the abilities of the children, based on the abilities of these individuals, we have to give the advice. We have to give the advice to the person or individuals to opt their courses, to choose their careers. Okay. So that is one type of counseling related to the students.
Okay, sir.
Okay. Okay. With this, we will conclude this today because already it is 4:50. Okay. Thank you.
Thank you, sir.
Thank you, sir. Well explained, sir.
Thank you, sir.
Hello. Thank you, sir. Bye.
Thank you.
Thank you, sir. Thank you, sir.
Yeah, can anyone just let me know what all topics we covered today? Like how many units we did? Hello.